is not usually something that I necessarily talk about because it's a hard-hitting discussion, usually something we have on City Matters in the sense of talking about the opioid use in the community. But Dr. Nenos, you and Charisse are here because Charisse, we're going to get your personal story. But we wanted to talk about the fact that this is a concern from the health expert community as well, right? Where you guys are looking at this going, we need to see change, and there are alternatives out there.
Absolutely. It's sad that this is happening in our city. We've known about it for years, and lately I was looking at the statistics here in our city because I had heard that the Hamilton-Wentworth community has such high rates of opioid-related deaths. And when I looked into it, actually the result of those statistics showed a trend of an increase in opioid-related deaths annually here in our city of Hamilton. What's crazy is that in Hamilton, here in our backyard, our opioid death rate is actually 78% higher than the provincial average.
Which is incredible, right?
It's absolutely incredible. And it's young people. The average age is about 36. The majority of them are male. About 3/4 of them are male. It tells us a lot of things. It tells us that there's a lot of people out there that are in pain and looking for solutions. And however good the intentions are of the medical community, unfortunately, a lot of these opioids, if not all of them, are highly addictive, and we have a serious problem now.
Mm-hmm. Right, which is just, it's scary. And when you take a look at this, these charts we've got up here,
you can see it just exponentially rising on the graph.
And that's the blue is Hamilton. Like,
the blue is
seriously,
Hamilton.
People.
Yep, and the orange right there is Ontario.
You know,
so 78% higher. I mean, you can't just throw more money at it. So you can see that the rates are actually increasing yearly. And when it comes to this, we need to have a solution that isn't just throwing more money at the problem and just throwing more drugs at the problem. Mm-hmm. There needs to be certain alternatives. And the health professional community, the health experts here in our city, are working to find solutions for these patients.
So let's talk about that, and then Charisse, you can sort of come into the conversation now and talk about the options that are out there and how people should maybe take a look at handling pain.
Yeah, there's natural health practitioners out there that will have a different approach. We definitely need the medical system in terms of emergencies, especially when it's related to overdoses and things of that nature. So it's proved to be a multifaceted approach that we need. We can't just have a single approach to this. Natural health practitioners such as chiropractors like myself and other health professionals have the resources that are necessary to help these patients. And one of them was Charisse, who was referred to my office. And rather than me kind of going into the details of Charisse's case, when she showed up, it was just the list of medication that she was on was astronomical. I couldn't believe it. And that's when I just had to wake up, get out of my bubble, that was my clinic, and realize that there's a serious problem in this community, and these people are looking for solutions that isn't necessarily more drugs.
And obviously for you, Charisse, like you were just doing what I need to do to try to get through the day because of the pain that you were in.
You know what? Actually, I got off opioids, and I feel so much better. I used 3 doctors, amazing doctors. I had a mentor doctor for 43 years. His name was Dr. Keith Lumack. He was absolutely fantastic. I'd just been overdosed. I got out of the hospital, had lost Dr. Lumack. I was dealing with personal issues from the past.
There's so many things that you can potentially be dealing with in your life. And, if you don't have that support, it's hard to get through it. And then that's when I think often we turn to alternatives and look for other things to help us.
And Dr. Michaels was great. He was a support, like from the start to the end. And then I went to Dr. Price, who's at Synergy Energy, and I obtained medical cannabis, which took the place of the oxycodone. It made me get off oxycodone. It was a cure for me. Mm-hmm. I tried getting off oxycodone. I was one of those ones, the statistics that you got off a few and then you went back up. So
and that's interesting too. You talk about the medicinal cannabis. I mean, like the stories on that, and I would ask you your opinion on that too, because it's more the natural way to help yourself.
With far less, if not any, side effects. I actually went to that office when Charisse brought this to me. So, like I said, doctors want to work together. Chiropractors, medical doctors, other health professionals really need to work together on this. So I actually visited the office. I left my office, went over there. I wanted to talk to them about what they were trying to accomplish by prescribing medical cannabis or cannabinoids, which are basically have the medicinal effects of cannabis without the high. And I was really, really impressed that their ultimate goal was to get people off the drugs. And together, working with them, working with the medical doctors, we were able to achieve that with Charisse, which is incredible.
Yeah, and it is fascinating, and I know many people who have used chiropractors over the years, including myself, for pain, for help, and it works. I mean, there's so much that goes on in our bodies. Like, who knows where the problem is stemming from? And there's lots of things you can try that would not necessarily involve drugs in the first place.
Hands down, the research is clear. When it comes to chronic pain, chiropractic works. This should not be disputed. This is not a myth. This has been shown over and over in systematic reviews and studies that it is a safe alternative to the other problem that we're having now, which is just placing people on more drugs.
Dr. Nenos, when I first saw Dr. Nenos, I was sitting like this. My neck was pushed out. I can sit upright. He's made a big difference in my life. Not only has he showed me that he went above and beyond for me as a patient, he's made me feel worthy, he's made me feel respected. You know, his interpersonal communication skills are absolutely phenomenal. And all three of my doctors that I have are absolutely amazing. I would highly recommend all of them to anyone.
Which is great. I mean, and it's so good to hear that story, and the fact that you're sharing it, right? You had, it was tough, it was rough for you, and you're coming out on the other side of it.
And I thought I had to take opiates to live, to function in my everyday functions of activities of daily living. I don't. I feel great.
I know.
And he's been amazing.
I know we could keep talking
He's
about
awesome.
this.
For sure.
But what is really great, and I think the message here is the fact that there are alternatives out there, that we can solve this problem. We're working on it slowly but surely, but we do know that it's an issue. We've got the latest out of the Barton jail as well, the stuff going on there. So, I mean, this is something that we really need to come together on as a community. And it's part of living here. Like, we need to really be aware and support this. So thanks for coming in, Charisse, sharing your story. And Dr. Nenos, always a pleasure to see you.
Thank you. Pleasure's mine.
You can check out Tree of Life Chiropractic on Twitter, Doc Nenos, and treeoflifechiro.ca.